Thank you for your interest in the Rural Health Clinic program. You've accessed part 1 of the 4-part session entitled Medicare Cost Reporting for Rural Health Clinics. The Rural Health Clinic Cost Reporting session is designed for individuals who may not be familiar with the Rural Health Clinic program and its unique cost reporting requirements. For additional information about Rural Health Clinic cost reporting, please access parts 2 through 4 of Medicare cost reporting for rural health clinics, as well as other focused educational rural health clinic webinars sponsored by the Wisconsin Office of Rural Health. In previous sessions, we've discussed that rural health clinic certification, it's an elective designation from the Centers for Medicare and Medicaid Services for clinics providing primary care in rural, underserved areas. And this elective designation provides for an alternative cost-based reimbursement system for treating Medicare and Medicaid beneficiaries. In this session, we will provide an overview of the Medicare Rural Health Clinic Cost Report, which is the reporting tool used in determining that cost-based reimbursement. The Medicare Cost Report is the tool used in reconciling payments made by the Medicare program to the Rural Health Clinic. This reconciliation compares the payments received by the Rural Health Clinic with the RHC's allowable costs for providing rural health clinic services. If total payments received by the Rural Health Clinic for a cost reporting period from the Medicare program exceeds the allowable costs, the provider or the Rural Health Clinic must repay the difference to Medicare. However, if total Medicare payments received by the Rural Health Clinic are less than the allowable cost, Medicare will make an additional payment to the provider or the Rural Health Clinic so that the total payments received by the RHC equal the Rural Health Clinic's Medicare allowable costs. Note that the Wisconsin Medicaid cost reporting is generally consistent with Medicare. However, the Wisconsin Medicaid program does have separate cost reporting forms that are to be used by the Rural Health Clinic to identify and reconcile payments received by the Medicaid from the Medicaid program for rural health clinic services. There are 2 different types of rural health clinics for cost reporting purposes, and the cost reporting is slightly different for each type of rural health clinic. Independent rural health clinics, which are generally owned and operated by private physicians or physician groups, must submit a rural health clinic cost report to a regional fiscal intermediary or a Medicare administrative contractor. Provider-based rural health clinics submit a rural health clinic cost report as a subset of the host provider's Medicare cost report. While the host provider is usually a hospital, a host provider for a provider-based rural health clinic can also be a skilled nursing facility or a home health agency. In Wisconsin, the Medicaid program groups provider-based rural health clinics with hospitals greater than 50 beds together with independent rural health clinics, so that for Wisconsin Medicaid purposes, hospitals that have provider-based rural health clinics but also have more than 50 beds file the same cost report as do independent rural health clinics. The filing of the Medicare cost report is due 5 months after the close of the cost reporting period covered. So for example, for a cost reporting period ending on December 31st, a rural health clinic cost report for Medicare purposes is due on May 31st. The Wisconsin Medicaid cost report, however, is due 30 days after the filing of the Medicare cost report. So in the same example, for a cost reporting period ended December 31st, the Wisconsin Medicaid cost report is due to be filed by the end of June. For rural health clinics that terminate their participation in the program, a cost report is due 150 days after the termination date of the provider agreement. Extensions to file the Medicare cost report may be granted by the intermediary or the Medicare contractor only for extraordinary circumstances, such as a natural disaster, fire, or flood. The Wisconsin Medicaid program will grant a 30-day extension. However, a request for extension must be filed in advance of the due date, so that providers cannot wait until after the due date of the filing of the cost report for requesting that extension. One question often asked is, what happens if we don't file the cost report within the 150-day requirement? Well, currently there is no penalty imposed for late filing of a Medicare cost report. However, Medicare will stop payments to the rural health clinic related to any claims filed with the Medicare program. So essentially, no further payments will be made by the Medicare program for services provided to Medicare beneficiaries until after the filing of the Medicare cost report. In addition to the claims not being paid, Medicare will also ask for all of the money back that they've paid for the rural health clinic from the previous year. So essentially, all of the interim payments that have been paid during the cost reporting period must be returned to the Medicare program, since the lack of filing a cost report essentially removes Medicare from its liability to pay for any of those services rendered during that cost reporting period. Wisconsin Medicaid will disallow any payments in excess of fee-for-service payments for Medicaid beneficiaries if the rural health clinic does not file a Wisconsin Medicaid cost report. So what type of information is needed to complete a Medicare cost report? We've listed a sampling of the types of information on the slide, including the financial statements for the rural health clinic. The financial statements are used in identifying the total cost incurred by the rural health clinic and are reported on the Medicare cost report. The rural health clinic must have software in order to prepare and file the cost report, since all cost reports are required to be filed electronically. The rural health clinic must report provider staffing ratios by provider type. So physicians, physician assistants, and nurse practitioners must all be separately reported along with their full-time equivalent status. A required component of the Medicare cost report is identification of the number of full-time equivalent providers by practitioner type. In addition to the full-time equivalent status, the rural health clinic must report provider visits for each type of provider. So for physicians, nurse practitioners, and PAs, the total number of visits must be separated. The rural health clinic must separate provider costs by type and separate administrative and general costs from the healthcare staff, so that a wage and benefit summary for each position within the rural health clinic is used to identify the wage and benefit cost for each type of practitioner, meaning each physician, nurse practitioner, physician assistant, as well as support staff, including medical support staff and administrative support staff. Equipment or fixed asset records are required in order to classify depreciation costs related to that equipment within the rural health clinic. A provider summary and reimbursement report, which identifies all of the Medicare charges, payments, and encounters, is used to reconcile the costs against the payments. This PSNR report is obtained by the rural health clinic directly from the Medicare contractor and includes a summary of all of the Medicare claims paid for dates of service that occurred during the cost reporting period. Flu and pneumococcal vaccines are reimbursed separately by the Medicare program as part of the rural health clinic cost report. Therefore, the rural health clinic must provide documentation of the actual vaccine costs, as well as the number of vaccines administered during that cost reporting period. Additional cost information is needed for services that may not be considered rural health clinic services. For example, laboratory costs are not considered rural health clinic costs on the cost report and must be removed from the allowable costs of the rural health clinic. Quite frequently, these costs are included in the total expenses of the clinic and must therefore be identified and reclassified on the Medicare cost report. Similarly, services such as radiology and other diagnostic services must be separately identified and removed from the allowable costs on the cost report. A relatively new service called chronic care management, which has related costs, must also be identified, since the costs associated with chronic care management services are not considered allowable costs on the Medicare Rural Health Clinic cost report. Only limited advertising costs are allowed by Medicare. Therefore, a detailed listing of all of the advertising-related costs incurred by the rural health clinic is required to separate out those allowable from the non-allowable costs. Other items required for completion of Medicare cost report include a Medicare bad debt log for any uncollected coinsurance and deductibles for Medicare beneficiaries related to rural health clinic services. Any additional costs that might not be included in the financial statements but might still be required to be reported as rural health clinic costs should be noted, as well as any costs that are included in the financial statements that are not related to rural health clinic services, such as contributions or donations to nonprofit organizations, are not considered allowable Medicare costs and must be removed from the allowable cost reported on the Medicare cost report. As we noted previously, the Medicare cost report is a tool used for reconciling payments made by the Medicare program with the rural health clinic's allowable costs for providing those rural health clinic services. Completing the cost report accurately enables the rural health clinic to obtain proper Medicare and Wisconsin Medicaid cost-based reimbursement for the services that the rural health clinic provides. The completed cost report also establishes an interim Medicare payment rate for the next cost reporting period. Thank you again for your interest in the Rural Health Clinic program. You've participated in part 1 of the 4-part session entitled Medicare Cost Reporting for Rural Health Clinics. For additional information about Rural Health Clinic cost reporting, please access parts 2 through 4 of Medicare Cost Reporting for Rural Health Clinics, as well as other focused educational rural health clinic webinars sponsored by the Wisconsin Office of Rural Health.